Welcome back to the Mental Health Minute. I'm Dr. Emily Mayfield, a licensed psychologist. In these videos, I highlight common mental health related topics and themes. If you haven't already, please subscribe to my channel and turn on the notification bell to be informed of upcoming videos. Also, comment below if there are certain topics you would like to see videos on in the future. For today's video, we will discuss what the first appointment with a psychologist looks like. If you have ever wondered what happens in a therapy appointment, this video is for you. Recognizing the presence of mental health symptoms you might be experiencing can be difficult. Add to that the realization you might need help from a professional. Many people struggle with accepting that they need therapy and delay treatment due to fear of the unknown. They wonder what people will think of them and what a therapy appointment might look like. If you are hesitant to talk to your friends about therapy and what to expect, this video will provide some answers so you can feel more confident attending your first appointment with a psychologist. So let's first discuss how you decide whether you need to attend mental health treatment. The first decision you need to make is whether therapy is right for you. This can be difficult to answer if you don't know much about therapy. Oftentimes, people delay treatment because they think they can fix things themselves. They do web searches, read books, and talk to others. Despite their best efforts, they aren't making any improvements. First thing to notice is that if you started to do web searches on specific topics and begin to read certain books, there's something about you and yourself you would like to change. This doesn't mean it has reached the level of a mental health disorder, but there are still problems you are encountering. Ask yourself what is different and what are you looking to change? Have you been eating more, getting out of the house less, arguing more with those around you, having trouble concentrating, trouble sleeping? You're the best judge of yourself, so you want to pay attention to areas that aren't working for you right now. If there is behavior you would like to change or moods you would like to work on, then therapy might be a good fit for you. Remember, you don't need to have symptoms severe enough to receive a mental health diagnosis. Ideally, you come to treatment before things get too bad. Next, you need to decide if now is the right time for treatment. Once you have decided your symptoms would benefit from treatment by an expert, you need to consider whether now is the right time for therapy. Therapy is a commitment, and you need to be ready to spend time making changes. Motivation for change is often not enough. Ask yourself, are you committed to attend your appointments weekly and work on the changes discussed in therapy? If the answer is yes, then now's the right time for therapy. If the answer is no, reevaluate in a month and see if you're ready to commit then. You're committed and ready to start. Awesome. Now what? Now you need to find a therapist and make an appointment. You can do a web search for psychologists in your area, talk to your doctor, or visit websites such as psychologytoday.com that provide a list of therapists based on your location. When finding a therapist, look at what their specialties are and whether they have experience treating the symptoms you are experiencing. You may not yet know what to call your experiences, so look for general terms such as anxiety, depression, etc. You also want to find a therapist that has many different treatment approaches. It is helpful to be an expert in one area. However, treatment is not a one-size-fits-all approach, so you want to consider a therapist that can utilize multiple techniques based on the individual's needs. Once you have found a therapist that seems to be a good fit for you, contact their office and schedule an appointment. The first appointments are usually 1.5 hours, so be sure to block enough time. Follow-up appointments are an average of 45 to 50 minutes. Now that you have an appointment scheduled, what do you do to prepare? There is actually little you need to do to prepare for the first appointment. The therapist has been trained in how to ask you what brought you to treatment. Although you may not know exactly what is happening, with you emotionally and mentally and may not know what you want from treatment, that's okay. Your therapist will be able to assist you in answering some of these questions. All you need to do is come to the appointment ready to provide information. Showing up for the first appointment can be anxiety-provoking because you don't know what to expect. Let's go over some things you can expect during that first appointment. When you arrive for your initial appointment, you'll be asked to complete initial paperwork. This is standard and required by law in most states. It will ask for your basic information such as name, address, and date of birth. And you'll also complete an intake form that gives you the opportunity to discuss your symptoms and what brought you to treatment. Finally, you'll complete forms that explain the treatment process for legal purposes and what limits there are to treatment. Most of what you discuss in your therapy session is only between you and the therapist. However, there are some things that must be reported to local laws, and most importantly, for your safety. This includes topics such as plans to harm yourself or others and abuse towards children and the elderly. The specific information that cannot remain confidential varies between states, so discuss this in more detail with your therapist. You might worry that someone else will know that you are seen for a therapy appointment. Aside from the specific limits to confidentiality, your therapist will not speak to anyone else about your appointment or even if you came in. You can rest assured the information will remain only between you and the therapist if you're an adult and have come to treatment voluntarily. After you've completed all the required paperwork, you'll meet with your therapist. Meeting with the therapist might be the most stressful part for someone that's new to therapy. Remember that the therapist is there to help you, and they understand it might feel uncomfortable and awkward to you. If you do feel uncomfortable, let the therapist know, and changes can be made in the questions asked until you feel more comfortable. During the first appointment, you and the therapist will discuss what brought you to treatment and what you'd like to get out of treatment. The first session will have a lot of questions that are asked of you, and this is so the therapist has information to work with. This information will be used to help develop a treatment plan that will guide treatment. There is no right or wrong answer to the questions the therapist is asking. They are purely meant to get more information about you. Be honest, and this helps you both develop goals for treatment. Treatment should be collaborative between you and the therapist. This means that you are the expert on you, and the therapist is the expert on the techniques. When you bring these two things together, you can make positive changes in treatment. When that first appointment is over, you now need to think about future appointments because therapy is an ongoing process. As you continue in therapy after the initial appointment, you'll focus on your goals through the use of various treatment techniques. You want to pick a therapist that gives you tools and techniques to manage your symptoms. While it might feel good to vent in therapy, this doesn't have long-term benefits oftentimes. When you are given techniques you can use to change your thoughts and behaviors, then you are more likely to have lasting changes. You might also be given assignments to do between sessions. Completing the assignments will allow you to transfer the skills to your everyday life so you don't have to remain in treatment. A very common question is, how long will I be in therapy for? Unfortunately, there is no way to know how long you'll be in treatment. There are many variables such as the severity of your symptoms, how often you come to therapy, and whether you actively participate in making changes. If you come to therapy motivated for change and actively participate, you can be in treatment for as little as a few months. Talk to your therapist about how long treatment is expected to last, and they should be able to give you a better estimate. Deciding to come to therapy can be a difficult decision to make, and signing up for the first appointment is often the biggest hurdle. Remember that the therapist is there to help you make the changes you're looking for and will remain non-judgmental. You don't need to know exactly why you're coming to treatment, but be aware of what issues you're having and what you would like to work on. By working together, you and the therapist will be able to develop a plan to help you meet your treatment goals. The sooner you present to treatment, the more positive the outcomes. Visit our blog linked below for more information on this topic and check out one of our other mental health minutes. I look forward to seeing you at the next video. Have a good day.